Most men believe that if their erection changes after starting a new medication, it's probably just stress, age, or fatigue. They take their blood pressure tablet every morning, their antidepressant at night, or their medication for heartburn without suspecting any connection. But here's what many don't realize. Some of the most commonly prescribed medications can quietly interfere with erectile function by affecting blood flow, nerve signals, or hormones. And this effect often doesn't appear immediately. If you're over 40 and taking medication regularly, this topic may be more relevant to your body than you think. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. Today, I'll help you understand how certain medications may affect erectile function, why this happens, and why it's important to talk openly with your doctor rather than stopping treatment on your own. To understand how medications can affect erection, we first need to understand what the body needs for normal erectile function. An erection depends on three systems working together: your blood vessels, your nerves, and your hormones. When you become aroused, your brain sends nerve signals to the penis. These signals relax the blood vessels, allowing blood to flow in and create firmness. At the same time, hormones like testosterone support sexual desire and response. As men age, especially after 40, this system becomes more sensitive to interference. Conditions like high blood pressure, diabetes, or cholesterol imbalance are common at this stage of life, and the medications used to manage them can sometimes affect one or more of these systems. This doesn't mean the medication is harmful overall. It simply means that what helps one part of your body may, in some cases, create side effects in another. One of the most common categories of medication associated with erectile changes is blood pressure medication. High blood pressure is extremely common in men over 40, and controlling it is essential for heart and kidney health. However, certain blood pressure medications, especially older types like beta blockers and some diuretics, can affect erection. Beta blockers slow the heart rate and reduce the force of blood pumping through the arteries. While this protects the heart, it can also reduce blood flow to the penis, making it harder to achieve or maintain firmness. Diuretics help remove excess fluid from the body, but they may also lower blood volume and affect hormone balance over time. Many men don't realize this connection because they assume erection changes are simply due to aging or stress, not medication. It's important to know that not all blood pressure medications have this effect, and newer options are often better tolerated. Another important category is antidepressants and anxiety medications. These drugs are widely prescribed and very effective for treating mood disorders, but they can also interfere with sexual response. A common group called SRIS increases serotonin levels in the brain, which helps stabilize mood. However, serotonin can also reduce sexual desire, delay ejaculation, and make erections less firm. This effect often appears gradually. A man may notice less interest in sex or difficulty finishing and assume it's emotional rather than chemical. What makes this more complex is that depression and anxiety themselves can affect sexual function, so the cause isn't always obvious. That's why open communication with your doctor is so important. In many cases, adjusting the dose or changing the medication can improve symptoms. Medications for acid reflux and stomach ulcers are another often overlooked factor. Drugs like omeprazole or similar acid-suppressing medications are taken by millions of men. Most don't expect these medications to affect sexual health. However, long-term use has been associated in some studies with mild hormonal changes, including reduced testosterone activity. Testosterone is critical for sexual desire and erection quality, especially as men age. These effects are usually subtle and develop slowly, which is why they often go unnoticed. This doesn't mean you should stop your medication, but it does mean paying attention to how your body feels over time. Hair loss and prostate medications, particularly finasteride, are another important category. Finasteride works by blocking the conversion of testosterone into a more potent hormone called DHT. While this can help with hair loss or prostate enlargement, it may also reduce libido, affect erection quality, or change semen volume in some men. For most, these effects are mild or temporary, but for a small percentage, they may persist. Awareness is key. Knowing this possibility allows you to monitor changes early and discuss them with your doctor instead of assuming they're unrelated. Finally, pain medications, especially long-term opioid use, can significantly affect sexual function. Opioids interfere with the brain's hormone signaling, which can reduce testosterone production over time. This may lead to low libido, erectile difficulty, fatigue, and mood changes. Chronic use of certain anti-inflammatory drugs has also been studied for potential hormonal effects, though research is still ongoing. Men who take these medications for long periods may not realize their sexual symptoms are medication-related rather than age-related. It's very important to understand this clearly. Not every man who takes these medications will experience erectile changes. Every body responds differently based on age, overall health, dosage, and duration of use. This video is meant to help you recognize possible connections, not to create fear or encourage stopping treatment on your own. Stopping prescribed medication without medical guidance can be dangerous. If you've noticed changes in sexual function while taking long-term medication, the safest and smartest step is to speak openly with your doctor. In many cases, alternatives or adjustments are available. So let me ask you this. Have you ever noticed a change in your body after starting a medication, but weren't sure if it was related? If you feel comfortable, share your thoughts in the comments. Your experience may help another man recognize something he's been ignoring. If this video helped you understand how medications and sexual health connect, consider subscribing to the channel. I post new videos every week focused on men's health, explained clearly and responsibly. In the next video, I'll talk about how lifestyle habits like alcohol, smoking, and sleep can either protect or weaken erectile function over time, and what changes actually make a difference. Take care of your health with knowledge, not fear. Thank you for watching.